Hello everyone, I'm Galen Gehring and welcome to New Cancer Mentality. Today we're fortunate to have with us Krystal Bocanegra, and her story basically started 3 years ago when she started feeling severe stomach pains and exhaustion. And at the time you thought these symptoms were due to being overworked or not getting enough sleep or something like that. She went to the doctor, she had a CT scan, and then was taken to surgery. And after that, you were diagnosed, correct me if I'm wrong, with a rare form of peritoneal mesothelioma. And today, you're here to inform our audience of your treatment and help others who may be going through similar circumstances like you have. So thank you so much for being here with us today, Krystal. It's great to have you.
Thanks.
And
thank you for having me.
yeah, absolutely. Sure. So when you were originally diagnosed with cancer, could you give us some of the background on the symptoms you were feeling at the time, or what your life was like before the cancer, like the contrast of that?
Sure. Well, before I was diagnosed, it was a few months after I graduated college, so I just started a new job. I was working in the fashion industry, traveling quite a bit for different shows and things like that. And so, I was just really busy with work, kind of embarking on my career, getting everything kind of settled and trying to get my life back on track, after school. So basically I was working a lot, and I just all of a sudden started feeling like really exhausted. And it seemed to be every month, as each month progressed, the symptoms seemed to have gotten worse and worse, to the point where I was just, I'd be at work and I couldn't keep my eyes open. I'd be at my desk and I'd be falling asleep. I had extreme pain in my stomach, and I had no appetite. Anytime I would try to eat something, I started to throw up, and it was just really odd. It seemed, it's nothing I'd ever experienced before. So then I finally decided, okay, something must be wrong. I should really go to the doctor and see what's going on.
Now, I'm sure never in your wildest dreams, or nightmares for that matter, you ever thought it was cancer.
No, absolutely not. I really just thought maybe I had some kind of stomach irritation, something, maybe I'd eaten something wrong, or something wasn't just reacting correctly with my stomach. So when I finally went to the doctor, she was kind of just pressing down and examining me, and she says, I was kind of screaming "Oh, you're pushing too hard in my stomach, you need to stop, this is too much." And she was I'm barely touching you, it seems like maybe you need your appendix taken out. And so that was kind of the first thing we thought of. And so she's like, but just to be on the safe side, I need you to go get us, I want you to get an ultrasound. So I went and I did that, and it was just one thing after another. Once I got the ultrasound, it just seemed as the radiologist was taking the test, it seemed like everything was kind of taking too long, and as if she wanted to say something, but there's only so much that they can say. So it was just one thing after another. And so I did the test, and they're like, okay, well, this ultrasound isn't showing us, it's not showing us enough, so let's do a CT scan. And then so within hours I had a CT scan done, and then that's when they contacted my doctor, and they're like, you need to, give her these results and see her. And once I saw my doctor the very next day,
CT scan?
She didn't really say, well, yeah, it was the CT scan. They'd seen a mass, and that's how they described it, that there was a mass by my ovary. And so, when they say mass, obviously to someone that's never really had any problems, I didn't really know what that meant. And my doctor was like, okay, so it could be many things. She's like, but I need to refer you to a gynecological oncologist. And so that's what they did. And basically she referred me to someone, and they kind of, at first they didn't want to see me. My doctor's like, you need to see someone immediately, but they were just, I think they were really busy. They were kind of booked up, and they're like, oh, I'm sure it's nothing. We have people come in here with problems like that all the time. So I ended up finding another doctor who saw me immediately, and he kind of ran down all the different types of scenarios of what could possibly be wrong. And the last scenario was cancer. He's like, it's a possibility. He's like, I have to throw it out there. But obviously he's like, the last thing, it could be cancer. He didn't think that's what it was, but he's like, obviously I have to
Right.
give you that scenario because it could be that.
Now, how long did you have to wait from that point that you were basically that they were suspicious until you were actually diagnosed?
Well, it was about after I went to see my primary physician, I actually saw my gynecological oncologist, I'd say 3 days afterwards. So once I met with him,
Okay.
he then, looked over my CT scan. He gave me kind of all these scenarios and talked about different things that could possibly be going on. And it was on a Friday, and he basically asked me, when are you free next week? Can you come in next week? You need to have surgery. So it was in days that from meeting him and him reviewing everything, they put me into surgery the very next week. So on that Tuesday, I went in for surgery.
And so then they removed that mass, and then after that they started giving you the chemotherapeutic drugs, or how did that?
Right.
Yes.
So basically, with the surgery, when we spoke, he said that he wanted to go in laparoscopically. So he was going to take the camera, do a small incision, and kind of see what was going on, because obviously there's only so much they could see through the CT scan. So once they did that, he said, obviously, I need to get your permission for everything before we go in, because we don't want to have to, do things twice. He's like, so I'll go in with the camera, see how it looks. If I can't remove it that way, I'm obviously going to have to, make a larger incision and operate that way. So I gave him permission to do everything. Turned out, he went in with the camera. There was a lot more going on than what the CT scan had shown. So they ended up, giving me a larger incision, removed the mass, and removed, kind of removed everything else that was around it. And, surgery went well. So 3 days after surgery, it was the day before I was going to be released. That's when they came in and they gave me the pathology report saying that I indeed had tumors that were lining the tissue of my abdomen, and they were cancerous. So, and then that's when they kind of came in and they gave me the verdict, and it was just like, you have this kind of rare form of cancer. It's peritoneal mesothelioma. Like I said, the tumors were lining the tissue of my abdomen, and so it was, because it was so rare, it was, that he came in with other doctors and they all kind of sat down and he said, this is what you have. There's not much evidence of, what we can do to treat it. So we're kind of all discussing and, we're talking to people kind of across the country to kind of figure out what the best treatment options will be for you. And so what they decided was going through chemotherapy, and they decided on 6 rounds, but we would see how the progression was halfway through. And they were going to give me a localized form of treatment, which is different than normal patients have. They were just going to attack the cancer directly through my stomach. So instead of giving me an IV through my entire body, they would give me... Right. Well, and that's the thing. They had no idea. Like, they couldn't give me any answers, They said, your hair may fall out, it may not. They're like, we just really don't know how you're going to react, because normally this is not how it's treated. Like, they were treating me as if they would treat ovarian cancer patients. They do more of a localized treatment with them. And so they said, we can't really guarantee you how you're going to react. We don't know. So everything was always a guessing game. Like, your hair might fall out. You might, be super exhausted. You might not be. You might throw up. I mean, everything was just kind of like, we'll have to wait and see what happens. And so that's basically what we did.
So was the treatment then you got, so after the first 3 treatments that you got, what was the evaluation? And was this treatment sort of radical, or was it just something that was, it wasn't the norm, in other words, correct?
Right. Well, it wasn't the norm. I'd go in 2 weeks in a row, and then I'd have 1 week off. So I was given 2 drugs. First week I was given the drug cisplatin, and the second week I was given the drug Taxol. So basically both of those drugs were given to me through an injection through a port that was in my stomach. And so I'd be, in the hospital for a couple hours given that drug. And then once it was over, I was, free to go home and kind of just relax and let the effects kind of take its course. So for me, I think because of my age,
what were the effects?
and,
How did you feel?
I was young and I was pretty. Well, in the beginning, it was.
Sorry.
I mean, it was hell. Honestly, I didn't expect it to be as hard as it was. I mean, they kind of warned me. They said you're going to be tired. I mean, when the doctors first told me what had happened, that I did have cancer, and they were asking me about my job and like what I did for a living and things like that, and they're like, you might have to take off work. Like, are you going to be able to do that? And I was kind of like, why? Like, I just never really comprehended like how serious it was until the first round. I mean, I got home and it was like I passed out right away, and the entire week they told me that after a few days I would kind of be alert and I wouldn't be as exhausted, or I wouldn't feel nauseous. It would take a couple of days to kind of like get out of my system, but for me it was the entire week. I mean, I went in on a Monday, and by Sunday I was still feeling horribly. I mean, I was nauseous. I could barely stand. I mean, I couldn't walk. I couldn't get up and like do anything really on my own, and I was sleeping constantly. The first drug, it's known to kind of make you confused, so it would be like I'd wake up and I'm like, what's going on? Like, I was just always really confused, and you have like the tingling in your hands and your feet, and it's just really weird, and that, especially for me too. I mean, I'm fairly small, so they have certain protocol for what the dosage should be, and after my first round, my doctor's like, you're really small. I think maybe we should lower your dosage, because I think my ribs were hurting. It was just, I was in so much pain. I could barely move, like I could barely stand. So they kind of altered that a bit, but that was what I was experiencing for the most part. The second drug wasn't as bad. It was just kind of gave me like a bloated feeling, and then by the end of the day, I was fine. And so the next day I would go to work during that second week. But after my third round, more and more the effects seemed to become greater. So I would get more nauseous, and by my last round I was actually, like, before I could leave the hospital, I was actually throwing up before I could even leave, and that never happened in the beginning. So it's like, as time progressed, my body seemed to have kind of been like rejecting everything and didn't even want to take all that in anymore.
Right. So was that the end of your treatment after those 6 rounds?
Well, I did 3 rounds, and that was, we had agreed upon 6. After the third round, they would do another CT scan just to see the progression, and so that's what we did. And they basically saw that the chemo was working, but it wasn't working as well as they had anticipated it to. So they then brought to me a different option of a heated peritoneal chemotherapy treatment, which would entail another big surgery. By that point, as you can imagine, I mean, I was 24 years old. I was working, but not working as much. I mean, my social life was kind of non-existent. And I was just, I was sick of it. I didn't want to, I didn't want to deal with it anymore. And so, just given the experience, no one could really tell me how everything was going to work out. I'd never spoken to anybody that had this type of cancer, so I couldn't ask anyone any questions, and they couldn't give me any definite answers. So with this other surgery, it was fairly new. 2 years prior, it was a clinical trial, and my doctor wouldn't be doing this procedure. I'd have to be sent to another hospital, to another doctor who was the only doctor in the state of Illinois that actually did it, and he had done 30. And it's like, okay, so you want to send me to a doctor that's done this procedure 30 times, and you can't guarantee me that it's actually going to work. So I told my doctor, I said, no, I don't want to do it. Like, I'm not doing it. And he kind of said, well, okay, I mean, I'm going to be real with you. You're young. You want to get married, and you want to have children, and you want to do all these things. Like, you need to have the surgery. This could possibly very well take your life. So I said, fine, I'll meet with this doctor, I'll see what he has to say, and we'll take it from there. So of course I met with the doctor, and he told me, yeah, you need the surgery. When can we do it? And I'm like, I don't want to do it. And he's like, what do you mean? You're crazy. Like, you really need this. I think this will really work for you. So after, I thought about it for a long time. I met Johnny Emmerman, who has this great organization out here in Chicago, and long story short, he introduced me to a young girl who had Yeah, Immerman Angels, right. He introduced me to a girl named Johanna who actually had this cancer 2 years prior when it was a clinical trial, and she had done the procedure and she had been fine since then. So I said, okay, meeting her, I kind of viewed it as like a sign, and I'm like, wow, this girl, she's just like me, she's my age, like everything. We have so much in common. You know, she had the surgery, she's doing well. It's at least worth a shot for me to go ahead and do it. And so I did.
That
and
must
so
have made you
I had
feel
the
so
other
much better
surgery.
meeting someone.
It was, well, yeah, because the entire time, I mean, for the past, 4 or 5 months that I had been going through treatment and everything, going to the hospital, I never saw anybody that looked like me. Everybody was older, everybody had a different form of cancer. I mean, I'd walk in to the hospital and people would look at me like, like, what are you doing here? Like, are you here to see somebody? Like,
right,
you know what I mean?
exactly.
Like, are you visiting somebody? I didn't look.
Can I help
and
you?
nobody had any idea, right? Nobody had any idea, like, what was going on. I mean, if you were to see me on the street, you'd have no idea that I had cancer because I looked normal. I had, my hair, I had long black hair, and the nurses would always, every time I'd go in for treatment, the nurse, they'd give me my treatment and they'd go out and they'd be like, let us know if you need anything. And as soon as they'd leave, they'd peek their head back in and they'd say, did anybody ever tell you that you might lose your hair? Like, I don't know if anyone's told you that. And I'm just like, yes, they told me. I'm not touching it until it starts falling out. I'm like, so we'll just see what happens. And that's what we did. So basically, I went and I had the second surgery. They did the treatment. Everything worked out. I was in the hospital in recovery for about a week. And then by the end of the week, they gave me the results to that. And the little kind of leftover tumors that they had found were not cancerous. Everything was fine. So they opted to not give me another round of chemo after surgery. It was just like, you can go on your way and we'll, do routine CT scans.
Oh, thank God,
every 3 months. Yeah. Mm-hmm. So yeah, so since
must have
then,
been
it was
music to your
March
ears.
24th of 2009. Oh yeah, it was. I'm like, finally, like, it's over, that I don't have to do anything. I can kind of get my life back together. And so that's how it's been since then.
So suffice to say, you never lost your hair.
Right. Never lost my hair. I didn't really lose any weight. I pretty much stayed about the same. I think with the loss of my appetite and the combination of, like, the drugs that they gave me, it kind of balanced everything out. So like I said, I mean, I looked the same, everything. The only thing was just those 2 weeks that I was actually going through treatment. And I mean, going through surgery, obviously there's a huge amount. I mean, I lost weight, and you lose your appetite and you're exhausted and you can't really do much.
Sure.
But for the most part, I mean, if I can use the word lucky, I think was very lucky compared to a lot of other patients, cancer patients that go through things that I didn't have to go through. I mean, my battle was 6 months in total, and people go through this for years and years. So I think the part for me, it was good that we caught it early, and I was able to, I had very good doctors and people that helped me. So it was pretty good compared to what it could have been.
Now, did you have a history of cancer in your family?
No, and that was also kind of something that was shocking too, because that's obviously the first thing they ask you, if anybody else in your family has had cancer, and no one else had. And as far as we had known, no one else, my mom's side or dad's side, had been diagnosed with it. And then just given the type of cancer I have or had, it was related to either exposure to asbestos or radiation. And I mean, I had no idea if I was exposed to either. So as far as I know, I knew I wasn't, but obviously there has to have been some exposure somewhere, kind of in my background, that obviously leads to this form, because it's really not genetic. It is, you have to be exposed to something. So.
Right, exactly. Now, it sounds, obviously you went through a whole ordeal. The 6 months was crazy. A lot of doctors, a lot of hospitals.
Yeah.
Treatment, cost. How did you deal with that?
Well, God, that's been a kind of issue in itself. Luckily, I like I said, I had just gotten out of college, so I just started my new job. I worked for a fairly small company, and I didn't have insurance. but given, you know, that my income and my age, the hospital basically paid for everything. Just because I, you know,
Oh my God.
had to apply for financial aid and kind of let them know, you know, I can't afford $4,000 a visit. Like, that's, you know, crazy. It's expensive, especially, you know, surgeries and things like that. Obviously, hospital bills can tend to be very expensive. And me being, you know, fresh out of college,
Yes.
I wasn't making very much money, so there was no way that I was going to be able to afford it. So I was kind of lucky in that aspect that I was able to receive help through them.
Yeah, I'll say. I had my appendix out, so I can relate to that stomach pain, and then I got a bill. It was like $35,000.
Right.
I was like, what? I was in the hospital for a day and a half. I can't even imagine.
Right.
Yeah.
I know, it's really crazy.
So talk to me about the mental state of going through that. I mean, you had said early on you were kind of in denial. I guess you didn't realize it was as serious until you went in for your first treatment, but that must have been really tough mentally to go through such a rare form of cancer, and from what I understand, a highly incurable one, right?
Right. Oh, and it was. I mean, you're right. When I first was diagnosed, I was completely in denial. I didn't want anybody to know. I mean, my family, immediate family knew, and I only told a select few of my friends, like people that I talked to on a daily basis or saw on a daily basis, because it's not really something you can hide. I mean, you can only hide having cancer for so long. I mean, if I'm not going anywhere or doing anything, people are going to start saying, well, what's going on with you? Like, you're always sick. Like, what's wrong? So it was really hard mentally, especially because I felt like I was very alone. Like, I had, you know, my family and my friends there to support me, but I never, through the entire ordeal, I never had anybody that I can, like, talk to or ask questions. And I mean, even the doctors, they weren't really sure how everything was going to turn out. I mean, how I was going to be affected, you know, how my body would experience everything. So mentally, it's just really, for me, it just felt really lonely. Like, I just didn't know what to do or what to expect. And you have to be strong, obviously, for everybody around you. And I never really wanted people to be, like, sympathetic or worried. I'm just very independent, and so that was part of the reason too. I never really wanted anybody to know, because I didn't ever want people to feel like, you know, they have to take care of me, or like, are you okay, or constantly, like, being worried about it. So for me, it was kind of a struggle. I felt like I had to do everything by myself, and, you know, just do it that way, and not really. I don't know. I never really wanted to burden anybody, so it was definitely very hard. And especially being so young, you never expect anything like that to happen to you. You know, you hear about it, and especially, you know, I had my plan. I was graduating. This is what, you know, I knew what I wanted to do, and everything has always been planned out. And then it's like, oh, you have cancer. Well, I didn't plan for cancer, so what am I supposed to do?
Yeah, right.
You know? So it was definitely very hard.
I didn't write that down. That wasn't part of one of my steps. Not happening.
Yeah, that wasn't in the plan. So it was hard, but
did you find,
you know,
that the hospital?
And like I said, my family was important.
I'm sorry, the delay is tough. Did you find that the hospital helped you with the physical as well as the emotional part, or like when did you finally see the light at the end of the tunnel, if you will?
I finally saw, I guess, really it wasn't until the end of my second surgery when they came in and they gave me the results that you're fine and the surgeries worked. And, you know, what we were concerned about, because, you know, the whole reason why they said we had to go in again was because they had thought that the cancer had spread. And so, you know, they did like biopsy tests, and when they did the test, they just weren't really giving them enough information to see whether or not I still had cancer. So after that second surgery, and they kind of gave me the results, and they said, everything's fine, you're fine, like, the cancer is no longer there, the tumors are not cancerous anymore, like, everything's okay. That's when it was kind of like, okay, I'm done. I mean, I know I'm never really out of the woods, you know, it's always a possibility that things can come back later in life, but at that point, it's like, at least I don't have to deal with this anymore, and I know kind of like what to expect and what's next, and I can kind of, you know, get my life back together. So that's when I really saw, okay, there's the light at the end of the tunnel. Like, I'm almost there. Everything
Right.
is going to be fine.
And how often do you have to go in for checkups to make sure everything is okay?
Well, it's been 2 years now, so I've been going every 3 months. Normally, once you hit the 2-year mark, they make you go every 6 months. So I'm a little bit past my 2 years, and I'm still going every 3 months. I think it's just, they do scans, and they see kind of a lot of post-surgical kind of things, during the scan. And so with my cancer, since it is so rare, I think they're extra cautious with me. So I'm scheduled to go in soon and have another scan done. And then after this one, we'll hopefully start doing every 6 months. And then after that, it'll be, every year or so. So.
Wow, that's great. Now, I have a question which seems rather obvious based on what you said, which is, how important do you find lifestyle factors to be when dealing with cancer? But obviously this cancer was in part brought on by a lifestyle. In other words, you were exposed to something that gave you this cancer, correct? So subsequently, do you feel like you're paranoid, you have to stay away from certain things? I mean, obviously you're not sitting there smoking. I mean, how do you deal with that going on moving forward?
I think I'm definitely a lot more cautious with some of my actions. I mean, I've never been a smoker, so it's kind of ironic that I get cancer, but I'm a lot more cautious as far as, like, even little things. I mean, I used to tan all the time, and I don't do as much as I used to, just because you never know. I feel like, does this make me more prone to, like, other types of cancer? So I am definitely a lot more cautious with that. Ever since I was diagnosed, I eat a lot healthier than what I used to prior to that. And I think that's also part of going through what I went through. I mean, I couldn't even tolerate anything that was, like, bad or greasy. Like, I could only eat, like, healthy, like, natural foods. And so it just kind of stuck afterwards.
So your body was telling you, in other words.
And so, yeah, I am I mean, it was like every time I'd go in, I mean, if I had eaten bad prior to treatment, I mean, I felt like they would see it, kind of in my blood count and, things like that. And every time I'd eat good and I was doing well, it was always, my body was, like, stronger. So, yeah, I definitely am more cautious and more aware of kind of my surroundings and, things I do, and try to kind of make the right decisions and not do anything that's going to, like, trigger anything else. So.
Sure.
But other than that, I feel like...
But at the same time, you have to live your life,
right? I'm not totally
right?
paranoid. Well, yeah, and that's exactly how I feel. If whatever's going to happen is going to happen. Right. And so, I mean, I'm not going to live my life and be in fear of getting this again. It's just, I take it day by day, and I'm not going to do anything that's going to physically hurt me. Just, kind of live my life, and we'll see how it goes.
This is so incredible. What helped you keep your faith the most through this? I mean, obviously there must have been ups and downs, but what was that strongest beacon of light for you? God, I think for me was having my family. We're all very close, and for them to really be around me and to, like, take care of me. At that time, we had my cousin, like, she was having a baby, and, like, all these, like, great things were happening in life. And to me, it was kind of like I wanted to do it not only for myself, but for everybody else. I mean, I know how much the people in my life care about me, and I wasn't going to just give up and, like, let myself die. I mean, you know what I mean? Like, I wanted to fight, and I wanted to be strong, and I wanted to get my life, like I said, I mean, before everything happened, I had everything planned out, and I knew what I wanted to do and where I wanted my life to take me. And so that was, like, a big thing to kind of get me through everything, like, just to stay focused, and just kept telling myself, like, this will end. I'm not going to have to go through this forever. There's a reason why I'm going through this right now, and if me having to suffer for this short amount of time can help someone later on in life, as far as be one more person, like, one more set of research to help someone else, then you know what? It's worth it. Because I would never want anyone to have to go through what I've gone through. So I figure, one more person, my story
will eventually help someone else in the long run.
So what advice would you give other cancer patients or patients who are dealing with this disease?
My advice would be, if you can find someone that's experienced what you are experiencing, I think that is one of the most beneficial things that you could ever experience, because you can ask them questions and they can really talk to you and they know exactly what you're going through. They're not just sympathizing with you, they're actually, they have a similar story and they can share things with you, and so you don't feel completely alone. And also, as much as I know it's kind of cliche, but you have to stay positive, because if you let yourself, start thinking negatively, that obviously affects the way things happen. I mean, if you truly believe everything's going to be fine, then everything will be fine. Like, you have to really just stay focused and be strong, and it's really important. I know, like, I'm just very quiet and I'm kind of like, I like to kind of be to myself, but I mean, if you can talk to somebody, let it out, it'll make help you feel better, and in the long run I think it'll be a lot more helpful in the struggle. So that's probably my best
That's
set
great.
of advice.
So is it true that you're writing a book?
No, I'm not writing a book. I don't know where that came from. I'm just kind of, right now I'm volunteering. I try to volunteer a little bit and try to get through, do things like this just to kind of help other people, and help other people kind of understand this disease, and at least be a voice for it, and just let people know that obviously there are positive outcomes, and this is something you can get through. So I don't know, maybe later on in life I will, but not right now. I'm not planning on doing that.
You had mentioned I don't know where I get these notes. Immerman's Angels before, and the organization.
Mm-hmm. Yes.
Is that one that you are part of as well?
Yeah, I'm part of their organization. I've been to a few of their events. I've been able to speak at a couple of their events, so that's been great. And meet a lot of great people. And like I said, I credit their organization a lot to helping me kind of get through this disease, because before I met Johnny and before I met Johanna, I was ready to give up. I didn't want to fight anymore. I didn't want to deal. I just wanted to live my life and pretend like I didn't have cancer. And so meeting them really helped me get my fight back, and helped me actually see that there's more than just giving up, and I can't give up. And so I always say, whenever Johnny calls me and asks me to do something, I say I will do anything, because if it wasn't for them, I have no idea where I'd be right now. Yeah.
Well, that's great. Have you gone back to work?
Yes, I've gone back to work. I stayed working a little bit while I was, going through the disease. It was not as much as I would have liked to, but I was working kind of part-time. And yeah, now I'm currently working, and I'm still working, and everything's been great.
Oh, that's fantastic. What a great story. I mean, in the end, obviously, so far so good, right?
Right, in the end. Right. Mm-hmm. Right.
Yeah. Well, it's been a pleasure talking to you. This is a great interview. Thank you so much for your time. What else can I say? It was great to get to know you and to learn about your story, and I wish you the best.
Thank you.
All right, Krystal,
well, I
thanks
appreciate
so
it.
much. And thank you for giving...
Thank you. All right.
Yes, thanks for giving our audience the opportunity to hear your story. It was wonderful.